Hello everyone, I'm Ying Wu and today I'd like to talk about gestational diabetes and public health. In early and middle gestation, with the increase of gestation weeks, fetal demand for nutrients increases and the glucose obtained from the mother through the placenta is the main source of fetal energy. Plasma glucose level of pregnant women decreased with pregnancy progression, and fasting glucose decreased by about 10%, while fetal glucose from the mother increased and the pregnant woman increased sugar output. Estrogen and prognestin increased maternal glucose use. Therefore, the ability of fasting pregnant women to remove glucose is stronger than that of non-pregnant women. To maintain a normal glucose metabolism during the second and third trimesters, insulin requirements must increase correspondingly. For pregnant women with limited insulin secretion, pregnancy cannot compensate for this physiological change, so that blood glucose increases, aggravating the original diabetes, or GDM. When it comes to how did this happen, sometimes, on the one hand, pregnant women are high risk of developing gestational diabetes because they lack control over their diet and sugar levels during pregnancy. In addition, women with diabetes are more likely to develop this disease during pregnancy. On the other hand, due to the lack of medical knowledge about health management and prevention, some abnormalities during pregnancy are ignored. So, this is a type of diabetes that occurs only during pregnancy. More than 80% of pregnant women with diabetes are GDM, and less than 20% of pregnant women with diabetes are GDM. The incidence of GDM is reported to be 1% to 14% in our countries and 1% to 5% in China. Gestation diabetes can cause health problems in both mother and baby. Managing your diabetes can help protect you and your baby. Most of GDM patients' glucose metabolism can return to normal after delivery, but the chance of developing type 2 diabetes is increased in the future. So the clinical cause of pregnant women with diabetes is complicated. Both mother and child are at risk, which should be paid attention to. During the pregnancy, the placenta makes hormones and can lead to build up glucose in your blood. Usually, your pregnancy can make enough insulin to handle that. If not, your blood sugar levels will rise and can cause gestational diabetes. Some ecological factors of pregnancy of gestational diabetes, including frequent urination and the person's testosterone, also the frequent vaginal bladder and skin infections, and so on. With regard to how to solve this public health problem, I'd like to say that the first one is tests for gestational diabetes, such as FDG and OGTT before your pregnancy. And the second one is management of pregnant women with abnormal glucose metabolism, such as certificatory standard for blood glucose control during pregnancy, and dietary therapy is also helpful. For example, diet is very important. The ideal diet control goal is to ensure and provide the calories and nutrition needs during pregnancy. Avoid postnatal hypernatremia or hungry ketosis, and ensure the normal growth and development of the fetus is very important. Also, the drug therapy is also effective. The safety and efficacy of oral hypoglycemic drugs in pregnancy have not to be fully confirmed, so they are not recommended at present. Insulin is a macrocellular protein that does not pass through the plankton and cannot be controlled by dietary therapy for diabetes. Insulin is the main therapeutic drug. Also, you can lower your chance of getting gestational diabetes by losing extra weight before you get pregnant if you are overweighted. Being physically active before and during pregnancy also may help prevent gestational diabetes. And with regard to prevent the public health problem, that if you should do a lot of projects before you are pregnant. For example, your chance of developing gestational diabetes are higher if you are overweight or you have a parent, brother, or sister with type 2 diabetes. In addition, if you have a hormonal disorder called phylloxy ovarian syndrome, also known as PCOS, that all of these factors that you should care about this. In my opinion, gestational diabetes mellitus is a diabetes or hypoglycemic disorder that is discovered during pregnancy. With the improvement of people's living standards around the world, its prevalence is increasing year by year. At the same time, blood glucose control during pregnancy is directly related to the safety of pregnant women and fetus. As a result, women should seek professional advice from an obstetrician and endocrinologist before they become pregnant. Normally, it is also necessary to properly control your diet and sugar intake. Okay, that's all. Thanks.